Dentists now can get specific training to better treat and care for people with special needs and seniors who typically find it difficult to get routine dental care. These dentists can become experts in the newly recognized field called special care dentistry. For more on this, what this means, we now have Dr. Tan Mei Na, President of the Special Care Dentistry Association of Singapore, and Consultant Dental Surgery, Tan Tock Seng Hospital. Dr. Tan, let's start the chat with you. Now, who or what type of patients are we looking at to expected to be served under the special care dentistry?
Yeah. So the first group would be patients with medical conditions. So these patients with more complex conditions that where their immune status may be compromised, they may be undergoing treatments that will affect the way that they receive oral dental care. The second group would be patients with special needs. So these can be persons with disabilities, with autism, learning disabilities, intellectual challenges, and a lot of times they are a little bit more combative to care and needs a bit more behavioral management. And the last group would be the older adults, and they tend to be frail. They may have neurocognitive conditions that may cause them to not be able to tolerate or tolerate treatment. So with such patients, we need to come up with a more tailored approach in how we treatment plan and deliver care to these groups of patients.
Right. So Dr. Ang, let's hear from you. So Dr. Tan said about tailored care. So basically we're addressing the challenges of these special patients. Tell us more about what these challenges are.
If we take the typical patient with dementia, for example, at middle stage to end stage, a lot of them are confused. Even if the family members bring them to the clinic, they may not even want to sit on the chair.
Right.
So even getting them to sit on the chair is a challenge. Then the next thing would be they would not want to open their mouths for you.
Right.
And so we have to find ways and means to coax. So for example, sometimes, like in my older Chinese population, somehow a lot of them like to listen to Teresa Teng songs. So we get the family members to play the songs on their phones, and I have to sing along to gain a bit of rapport. And even then, occasionally it may not work, and then we still have to look for ways and means to do what we need to do for them.
Now, how do you think this recognition of this special field will impact the dental care of the country? Now, for example, how will these dentists be different from other dentists in terms of treatment or care?
I think recognizing it will help to raise awareness so that patients can get the care that they need. Because some of us, we do get patients who cannot be managed by the general dental practitioners. And I think with this recognition, there is a certain level of a comprehensive care that we deliver based on what is accepted and what has been proven according to like best practice guidelines.
So it's actually beyond just dentistry, isn't it? Because you really have to be looking into, say, for example, the special needs area, like the dementia, the Alzheimer, the ADHD. Yes. So the training is different?
Yes, so the training encompasses more than just looking into the mouth, right? You need to, the medical conditions is one.
Right.
Patient communication is another one, behavior management. So we care for the patient, I would say, more holistically rather than routinely, where we just focus in the oral cavity.
Exactly. Yeah. Dr. Ang, you're one of the earliest pioneers in this area, special care dentistry. Would you say making this specialization means higher dental costs over time? So, for example, the visits could actually be longer than a regular, patient. I mean, seeing specialty and also, specialist training or treatment is typically more expensive.
In a way, you're right because of the specialist level of care. Yeah. But we have to understand that for this group of patients, because they are not able to find, because a lot of private dental surgeons may not be comfortable treating them in the first place. So, though the cost may be higher, but we need to provide people with an avenue for them to receive the right care at the right place. So in that sense, it may be higher, but compared to no care at all, I think it's still a better option.
And I suppose the question for the both of you, perhaps Dr. Tan first, what are your hopes, I suppose expectations for the future of special care dentistry, given it's a newly recognized area, and of course kudos to that. What would your hopes and expectations be in Singapore for the next, I guess, 5 to 10 years?
So I hope that with this recognition, people are more aware. Patients who need the care know where to access this care. And I hope that as a specialty we will grow. We can attract people to join us in this mission to ensure that people can, all kinds of people, can have access to good quality dental care. Yeah, that's again based on guidelines that's been established, evidence-based. Yeah.
Well, I think it's been widely reported that currently the biggest challenge for our country is the aging population. And so it is a fact that there are actually still very few of us. So with recognition, we are giving people, we're willing dentists who want to do further training in this field a career path. So we can get more numbers. So to provide to have more avenues for patients who need it to receive the proper care. So it's great that it's finally recognized as a specialty.
All right, thank you so much for joining us.
Thank you very
for
much.
Sharing. And that was Dr. Tan Mei Na, President of the Special Care Dentistry Association of Singapore, and Dr. Ang Kok-Yang from Tan Tock Seng Hospital.